The occupational English test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a new patient called Mrs. Delilah. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. What's your problem?
Well, I have persistent mild weakness in the left leg and occasional off and on numbness in the left hand. I have shortness of breath often.
Do you feel any weakness in your arm?
No, doctor, but I am ambulating with a cane.
Was there any history of falling down?
No, doctor. I had repeat carotid Dopplers and further imaging studies shows no further increased stenosis in my left internal carotid artery.
Okay. What is your age?
51, doctor.
You had any illness and treatments?
Yes, I had cerebrovascular accident but got treated.
What medications are you taking?
Plavix, aspirin, levothyroxine, lisinopril, hydrochlorothiazide, Lasix, insulin, and simvastatin.
Any allergies due to medications?
No, doctor.
Is there any history of illness of your family members?
No, doctor.
Well, your blood pressure is 170/66, heart rate 66, respiratory rate 16, your weight is 254 pounds, and your temperature is 98. Normal cephalic and atraumatic, no dry mouth, no palpable cervical lymph nodes. Your conjunctiva and sclera were clear. Your cranial nerves show mild decrease in the left nasolabial fold. There is a mild increased tone in the left upper extremity. Deltoid shows 5/5. The rest shows full strength. Hip flexion is 5/5 on the left. The rest shows full strength. Reflexes were hypoactive and symmetrical. Your gait is mildly abnormal. No ataxia noted. Wide-based, ambulated with a cane. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral pedicle, with a mild left hemiparenthesis. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral peduncle, with a mild left hemiparesis, has been clinically stable with mild improvement. For now, continue using antiplatelet therapy and statin therapy to reduce the risk of future strokes. Continue to follow with endocrinology for diabetes and thyroid problems. You must strictly control your blood sugar level, optimizing cholesterol and blood pressure control, regular exercise, and healthy diet. I am planning for surgical intervention for the internal carotid artery.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Gregorius. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Gregorius. Be seated. Tell me what your problem is.
Good morning, doctor. I'm having severe abdominal pain and nausea after eating.
What's your age?
38, doctor. I'm intolerant to fatty foods and my urine is dark colored.
Do you get fever?
Yes, I get chills and low-grade fever, nausea, and a sharp stabbing pain in my abdomen. But when I lie down on my right side, I feel somewhat relieved.
How long have you been suffering with these problems?
For the past 3 months, doctor.
Have you had any surgery before or any diseases?
No, doctor.
Are you taking any medications?
No, doctor.
Are you allergic to any medicine?
No.
Do you smoke or drink?
I do smoke 1 pack a day, but I never drink.
Do any of your family members have a history of any diseases?
No, doctor.
Tell me something about your family background.
I am married and living with my husband and 2 children.
Do you have any symptoms of seizures and ataxia?
Yes, doctor, I have.
Well, your MRI report is positive for cholelithiasis without CBD obstruction. Laboratory studies show that you have elevated bilirubin and elevated white blood cells. Your heart rate and rhythm is regular without any murmur or gallop. Bowel sounds are of a high pitch. Lower extremities are normal in color, touch, and temperature. No ischemic changes are noted. Range of motion is normal. You have developed gallbladder disease. I would suggest laparoscopic cholecystectomy with intraoperative cholangiogram.
Okay, doctor.
This is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25. You hear a monologue by a physician explaining to his staff about Ballontidium coli. Now read the question. Ballontidium coli is an intestinal protozoan parasite that can infect human beings, which are transmitted through the fecal-oral route by contaminated water and food. Although Ballontidium coli infection is mostly asymptomatic, patients with other severe illnesses can experience abdominal pain, persistent diarrhea, and sometimes a perforated colon. Ballontidium coli is a parasitic species of ciliate alveolates that causes the disease Ballontidiasis, which is the only member of the ciliate phylum known to be pathogenic to humans. Question 26. You hear a monologue by a physician explaining to his nurse about Hansen's disease. Now read the question. Hansen's disease is caused by slow-growing bacteria called Mycobacterium leprae that affects the nerves, eyes, skin, and nose lining called nasal mucosa. The disease can be cured with early diagnosis and treatment. Hansen's disease was once considered as a highly contagious and disastrous disease. However, today we know it doesn't spread easily and there are effective treatments. If left untreated, the nerve damage can result in crippling of feet and hands, blindness, and paralysis. In very severe cases, the patient may have multiple injuries due to the lack of sensation, and eventually the body may reabsorb the affected digits over time, resulting in the apparent loss of toes and fingers. When the disease affects the facial nerves, corneal ulcers and blindness can also occur. Other signs of severe Hansen's disease may include loss of eyebrows and saddle nose deformity, causing damage to the nasal septum. Question 27. You hear a physician discussing Japanese encephalitis and its risk factors. Now read the question. Hello, doctor. What is Japanese encephalitis and who is at a higher risk? Japanese encephalitis is a serious infection caused by the Japanese encephalitis virus that occurs mainly in rural parts of Asia. The disease is mainly spread through the bite of an infected mosquito, however, it does not spread from person to person. The residents where the disease is common or the people who travel frequently have the higher risk of this disease. Most of the patients do not develop any symptoms. Patients with Japanese encephalitis experience fever, neck stiffness, seizures, and coma. The disease has a mortality rate of 1 out of 4 patients. 50% of the patients have permanent disability. It can even harm the embryo of a pregnant woman. Question 28. You hear a physician talking about epilepsy and seizures. Now read the question. Doctor, what is epilepsy and what is a seizure? Epilepsy is a neurological or brain disorder which is also called a seizure disorder at times. Often, the patient is diagnosed with epilepsy only when they have already had 2 or more seizures. A short change in normal brain activity is called a seizure, which is the main sign of epilepsy. While certain seizures appear like starting spells, other seizures cause the patient to fall, shake, and become unaware of what's happening around them. Generally, a seizure lasts up to a few minutes depending on the type of seizure. Generalized seizures affect both sides of the brain, and focal seizures or partial seizures affect one side of the brain. Question 29. You hear a physician discussing about Lyme disease and its consequences. Now read the question. Hello, doctor. What is Lyme disease and what are the consequences of it? Well, Lyme disease is caused by the bacterium Borrelia burgdorferi and is transmitted to humans with the bite of the infected black-legged ticks. Typical symptoms include headaches, fever, fatigue, and a characteristic skin rash called erythema migrans. Infection can spread to joints, the heart, and the nervous system if left untreated. Generally, Lyme disease is diagnosed by its symptoms and physical findings, such as the rash. Laboratory testing can be precise only if performed appropriately with validated methods. With a few weeks of antibiotics, the disease can be treated successfully. Question 30. You hear a physician explaining to his nurse about Omsk hemorrhagic fever. Now read the question. What is Omsk hemorrhagic fever, doctor? A member of the flavivirid virus family called Omsk hemorrhagic fever virus causes this disease. The disease was initially detected between 1945 and 1947 in Omsk, Russia, from patients with hemorrhagic fever. The primary host of the disease is the rodents from the bite of an infected tick. Common tick vectors include Laxodes persulatus, Dermacentrum marginatus, Dermacentrum reticulatus. Common rodents infected with the disease include the muskrat or the Andrada zibethica, water vole or Arvicola terrestris, and narrow-skulled voles or Microtus gregalis. However, muskrats are not native to the Omsk region, but were introduced to the region, and now they have also become a common target for hunters and trappers. Muskrats become ill and die when infected with the virus. OHF occurs in the Novosibirsk, Western Siberia regions of Omsk, Tyumen, and Kurgan.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36. You hear the lecture given by a physician on the standard method of diagnosing attention deficit hyperactivity disorder. You have 90 seconds to read questions 31 to 36. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. overfocused attention deficit disorder. People with overfocused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. Temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic attention deficit disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of fire attention deficit disorder. People with ring of fire attention deficit disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious attention deficit disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types. Now look at extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on scleroderma. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Could you please explain different types of scleroderma?
Well, scleroderma is a symptom of a complicated group of diseases by an abnormal growth of connected tissue that supports the skin and internal organs. This disease is also termed as systemic sclerosis. Scleroderma literally means hard skin, derived from the Greek words sclerosis, meaning hard, and derma, meaning skin. Scleroderma is considered both rheumatic disease, since the conditions are characterized by inflammation and pain in the muscles, fibrous tissues or joints, and a connective tissue disease. Certain types of scleroderma have a limited abnormal process that primarily makes the skin hard and tight. Other types are more complicated, affecting the internal organs such as the lungs, heart, and kidneys, and the blood vessels. A phrase identified as softening occurs, during which less collagen is produced. There are two main classifications of scleroderma. Localized scleroderma, that affects only certain parts of the body, that includes linear scleroderma and morphea, and systemic sclerosis, that affects the entire body. Localized scleroderma. Localized scleroderma affects the skin and related tissues, and at times the muscles below. However, internal organs are not affected. Localized scleroderma can never advance to the systemic type. Moreover, localized types can improve over time. However, the skin changes that occur during the disease can be permanent. It may be serious and disabling. Morphea. Reddish patches of skin that thickens into firm oval-shaped areas are distinctive characteristics of the morphea type. The centers of the patches appear ivory with violet borders. The patches occur on the stomach, chest, face, back, legs, and arms. Typically, these patches sweat a little and have little hair growth on it. Morphea can limit to one or several patches, ranging from ½ inch to 12 inches in diameter, or else it can be hard and dark, spreading over larger areas of the body. Morphea generally fades out in about 5 years. However, people can have permanent dark skin patches and muscle weakness. Linear scleroderma, characterized by a distinctive single line or band of thickened, abnormally colored skin. Typically, the line runs down an arm or leg and can run down the forehead. Systemic sclerosis not only affects skin but also involves blood vessels and major organs. Patients with systemic sclerosis often have all of the following symptoms, known as CRESS syndrome, an acronym for calcinosis, formation of calcium deposits in the connective tissue. Raynaud's phenomenon. Small blood vessels of hands or feet contract in response to cold or anxiety. Esophageal dysfunction. Impaired function of the esophagus occurs when smooth muscles in the esophagus lose normal movement. Sclerodactyly. Thick and tight skin on fingers result from deposits of excessive collagen within skin layers. Cholangiotasis. Small red spots on the hands and face are caused by swelling of tiny blood vessels. Systemic sclerosis is further divided into two categories, called limited and diffuse. Typically, limited scleroderma has a gradual onset and is restricted to certain parts of the skin, such as hands, fingers, lower arms, face, and legs. Often, Raynaud's phenomenon is experienced for years before skin thickening becomes evident. Calcinosis and cholangiotasis often follow. At times, limited scleroderma is referred to as CRESS syndrome because of the predominance of CRESS symptoms in these patients. Typically, diffuse scleroderma has a sudden onset. Skin thickening develops quickly and covers much of the body in a symmetric pattern. Most of the internal organs can be damaged. Skin can swell, appear shiny, and feel itchy and tight. The damage of diffuse scleroderma occurs over a period of a few years. After a period of 3 to 5 years, patients tend to stabilize, a phase when progression of the disease seems little and symptoms subside, but gradually. Skin changes begin again. A phase identified as softening occurs, during which less collagen is produced and the body rids of excess collagen by itself. This is the end of Part C. You now have 2 minutes to check your answers. That is the end of this listening test.